I'm working on a number of things having to do with new reproductive technologies, but with a particular focus on the impact not only on subsequent generations, but women today. My impression, my concern is that there's a huge focus on the next generation, on the children to be born, but then insufficient attention to the women who are participating as research subjects ultimately. They are the people that are being asked to provide genetic material. They are the people who are being asked possibly to carry these genetically modified children, and I don't think we're paying enough attention to them. I'm Françoise Baylis, and I am a Distinguished Research Professor Emerita at Dalhousie University in Nova Scotia, Canada. I think I'm frustrated insofar as in this particular space, there tends to be a lot of attention to things that I put in the category of wants. And so we focus on couples that want children, and then they don't only want children, they want a specific kind of child. They want a child with specific genetic traits, and the simplest of those specific genetic traits are their genes. And so the parents think, our genes are important, we want to have children that have our genes, and that's what motivates the argument to say we need to develop genome editing technology so that couples can have healthy, genetically related children. Well, one of the things I worry about there is that that actually promotes a very specific way of thinking about what's important about parenthood, as if what's important is the genetic material. Well, that's not what makes for being a good parent. And if all you're concerned about is passing on your own genes, that actually says something that could be interpreted in a particular way as a little bit on the selfish side, that really you're focused on yourself more so than on the child. I think when you're looking at children and you're looking at parenting, what makes a good parent is wanting to take on the responsibility to nurture a person into being a good civic participant, if you will. And so in my own work, I draw the distinction between wants and needs, and I believe society should respond to needs, and I think we need to be able to understand that a lot of what we're seeing now is being cast as a need, but in fact it's a want. It's a desire for a child with specific genetic traits, and those genetic traits, yes, some of it has to do with genetic health, but a lot of it has to do with my genes being passed on to the next generation. And I think that that's not where the focus should be. Parenting is not about genes. When people talk about it technically, they all say, oh, it's this multidisciplinary activity, etc. And I think the way to talk about it more reasonably is to say it's about inviting multiple perspectives on the kind of world we want to live in. And all of my work is anchored in trying to get people to answer that question. What kind of world do we want to live in? I think that's the most important question that bioethics asks. And you have to ask and answer that question, I think, before you get to any of the specific questions. So before you ask me about, should we do, brain-machine interfaces? Should we do xenotransplantation? Should we do anything? I don't care what technology you want to ask that question about. It's a should question, so it is an ethics question. But before you get to that specific question, answer the question, what kind of world do we want to live in? And then when you have that answer, you can say, will this technology help me build that world? And that's the order in which I would like to get people to think about bioethics. What kind of world do we want to build? I think the biggest challenge today is money. I think there's a particular way in which contemporary commerce and the profit-making world that we live in is distorting our capacity to ask the right questions. And I think when we try to articulate answers to those questions, too often they're influenced by what money can or can't be made. What I mean by that is that we hear, for example, today about how we're really seeing this compression of time between basic science research, a creative idea, and then quickly it turning into some kind of a technology. Often that technology is about monetizing that idea, and often what we're looking at is the ways in which the money is transferring hands, and then people are thinking about that. And I think the other thing that's really making bioethics challenging is we now have a a different kind of influence, if you will, coming from the private sector. Up until now, a lot of work in bioethics has been done at an individual level, but then also at a national level, and then internationally with declarations and treaties, etc. And that's between governing states. And I think what we need to understand is the power brokers are changing. We can no longer have these conversations assuming that the nation state is where those decisions will be made and implemented. And I think really one of the things we need to pay attention to is theoretically in the public space we're looking at the common good, and in the private space we're often looking at profit. How do we get those competing values to talk to each other? How can we negotiate reasonable compromises in terms of the answer to that all-important question, what kind of world do we want to live in? Let me say what I worry about in terms of where we might be in 10 years, and I say this not as a prediction but as a warning. I think one of the things that troubles me is issues still to do with gender. I thought over my lifetime that we had made tremendous progress, and I now see that being called into question with decisions being made in different parts of the world in terms of women's access to education, women's right to control their bodies and their decision making around their reproduction. These are things that I thought had been successfully addressed, and to see them come up for debate, question, and in some cases, I would say a stepping back from what I thought was really positive efforts to really recognize the equality of the two sexes is very distressing. And I worry about it because a lot of my work over my career has been around reproduction and defending women's interests around a range of ethical issues to do with reproduction.